and welcome to NAMI Tennessee at Home Live. My name is Gabe Howard, and we have another great show for you with not one, not two, but three awesome guests. But before we get to all of them, I have to tell you, you would have already known this if you had signed up for NAMI Tennessee's email list. Just go to namitn.org and we will tell you all of the stuff that's going on at NAMI Tennessee, but we also give you great hints and tips for legislative advocacy, things that you can do to help make the world better for people living with mental illness and their families. It's a really cool email. It comes out about once a week, and I am fond of saying in every single episode, because I don't write new jokes, the more people sign up, the closer that I get to a free toaster. So just head over to namitn.org and sign up right now. All right, without further ado, we have a super awesome panel. Who would like to introduce themselves first?
I will. Hello, everyone. My name is Jennifer Ramcharan. I am the Education and Outreach Specialist for the Insurance Division of the Tennessee Department of Commerce and Insurance. Thank you so much for having us today.
Oh, thank you so much for being here. Who would like to go next?
I'm going to go next. My name is Vickie Trice. I am Director of the Consumer Insurance Services area, also with the Tennessee Department of Commerce and Insurance, and it is a pleasure to be here with you today. Thank you.
Oh, thank you so much for being here. And of course, that leaves Lisa.
Hey, everybody. I'm so glad to be here. My name's Lisa Ragan. I'm Director of Consumer Affairs and Peer Recovery Services for the Tennessee Department of Mental Health and Substance Abuse Services. A lot of what I do is related to peer support, and I'm a peer myself. I live a life of wellness and recovery from complex PTSD, and these days I am focused on post-traumatic growth. Happy to be here.
That's awesome. Thank you all once again for being here and for taking time out of your busy schedule. All right, let's hit the ground running. This first question is for Jennifer and Vickie. What is the mission of the Tennessee Department of Commerce and Insurance? And what is the department's role for people who live in Tennessee?
Jennifer, you want to take that or you want me to go?
Sure. I'll explain the mission and then we can go into a little bit more of your area, Vickie.
Sure. Okay.
So the department's mission is fostering fair marketplaces, public safety, and consumer education that promote the success of individuals and businesses while serving as innovative leaders. So what that means is basically we're all about balance. We're about protecting the consumer while also ensuring that we have a very healthy insurance industry in Tennessee. Our role, really the department's role, is we are the regulators of any insurance agents and insurance companies that are in Tennessee. They have to get their licenses through us. We make sure that everybody is doing what they're supposed to be doing for the greater good of Tennesseans. So Vickie, why don't you talk a little bit more about your area?
I certainly can. So I am Director of the Consumer Insurance Services area, and primarily what my area does is to handle consumer complaints for the entire state of Tennessee. I've got a team of life and health and property and casualty investigators, and we regulate all lines of insurance. So that, of course, includes mental health insurance as well as any other type of insurance product. We mediate those complaints and try to bring them to an agreeable resolution for the consumer. We've returned $8.2 million of restitution in 2021.
That is amazing. That was a number that I was not expecting. What is the process for that? Because that's a big number, and I have to imagine you don't just trip over that kind of money accidentally. What is the process, like in short, like in sound bites, as it were? What is the process for retrieving those kinds of funds?
Sure. So basically, the consumer contacts our office and they file a complaint. They have an issue with an insurance company. It can be an auto issue, homeowner's issue, health issue, life insurance policy, whatever line of insurance it is. They fill out the complaint form. It gets assigned to one of my investigators, and we just mediate that complaint between the consumer and the company to try to bring it to an agreeable resolution. So in a lot of cases, we are able to get those claim denials overturned and get those claims paid. And it's a simple process. It usually takes 30 to 45 days for us to actually mediate the complaint, depending on the complexity of the issue. But we just work to try to make sure that the consumer is made whole.
That is incredible. Thank you so much. Lisa, the next question that we have is going your way because we didn't want to leave you out. How does Tennessee help those with mental health illnesses? I mean, like the whole state. You have to answer for the entire state.
We do. It's fabulous and I love it. First, I really just want to say how great it is to meet both Jennifer and Vickie. I'm excited about the work you do. It is so powerful and I'm looking forward to learning more about it and spreading the word. I have to say how proud I am to work for the Tennessee Department of Mental Health and Substance Abuse Services. One of my favorite things about working with the department is I just feel like we all have the same heart. We have this heart for service and we care so deeply about Tennesseans and making sure that they get the behavioral health help that they need. We have a budget actually of more than $500 million. And so with those funds, our department provides a whole range of services from education, prevention, treatment, recovery. We serve Tennesseans from infancy all the way to those golden years, of course. I would say our first line of mental health services is our statewide crisis line, and that's 855 Crisis 1. And that's available 24/7, 365 days a year. We actually have a full crisis continuum with lots of different services. We have the mobile crisis response teams, crisis stabilization units. And then, we also provide tons of programs in the community, such as like we have help for housing and homelessness. We have peer recovery services. That's mostly my area. Suicide prevention, school-based behavioral health liaisons. We have first episode psychosis programs that are so important. And then there's also all the substance use disorder programs. We have naloxone overdose prevention. That's the Narcan they're passing out to help people who have overdosed. Detox programs, medication assisted treatment, recovery housing, recovery courts. Truly, I could go on and on. But one thing I do want to explain is that our services are actually not usually provided by state employees. What we do is we contract with providers throughout the state. Behavioral health organizations. For example, that'd be places like Alliance Healthcare Services, Centerstone, Volunteer, McNabb Center, Frontier. I tried to just give, some examples throughout the state, just to name a few. For my area, that particularly focuses on peer recovery services, which I could talk about all day. We actually have more than 750 certified peer recovery specialists in our beautiful state. So these are individuals with lived experience of mental illness and or substance use disorder. They're doing really well in their wellness and recovery, and they can go through a 40-hour training to learn how to provide peer support to others and then get a job working as a certified peer recovery specialist. We have a similar certification for young adults, and we also have parent peers called certified family support specialists, which is something that NAMI Tennessee is very involved in and helps support through training. I really think nothing can compare to the power of the peer. They truly serve as an emblem of hope throughout our state, showing others, that you really can achieve wellness, resiliency, recovery. And peers can help with advocacy too, which I think is important in what we're talking about today with parity. They can help folks talk with their insurance company, talk with their doctors, and help them file a complaint, help them contact Commerce and Insurance, whatever they might need.
Lisa, thank you so much. I want to touch just a moment on peer support. Peer support's been around for about 10, 15 years. It's actually a lot older than many people think, but it's just now starting to gain ground in the last few years. And of course, the pandemic put us a little behind because nobody was really working out in the public. But for those who have heard of peer support but aren't quite sure what it is. For those people who are like, well, I've heard of peer support, but I don't like it. They should only see doctors. Can you address a little bit? I don't want to call it controversy because it's not fair to call it controversy, but I understand that anytime there's something new, there's a little pushback. And I think that pushback is good. It means people are paying attention, and it gives us as peer recovery supporters an opportunity to say, no, here's our role, here's where we belong, and here's what we do, and here's how we work with the greater good. Can you talk about that a little bit just to get everybody on the same page?
Sure, absolutely. I think it's important to point out that peers in no way want to replace treatment, replace clinical services. They're not a duplicate of any of that. It really is its own unique service where they really walk alongside someone, do a lot of listening, and then when appropriate, share part of their own recovery journey to help inspire folks, moving forward in theirs. One of the biggest things we focus on in training is teaching people not to give advice. And I think it is human nature to want to give advice. Imagine if you're working with a peer and they're going through something that you yourself went through and maybe you blew it. And so you just can't wait to give them advice and tell them what to do. And that's what we learn how not to do. We're going to listen. We're going to be there with you. It's about the relationship.
Thank you so much. And I also want to take the opportunity to point out that everybody calls it peer support. I hear peer support, peer support, peer support, but there's a word in there that is often missed, and that it's certified, right? So you can't just walk in one day and declare yourself a peer supporter and start working for agencies and start working with people with mental health or substance abuse issues. There's a certification process. Can you touch just the Reader's Digest version, or the TikTok version, as my niece says, about how to become certified and why that is so important to the process?
Absolutely. The certification in Tennessee started in 2007, and I have really seen the profession elevated through the years as a result of that. We have a lengthy application process, just trying to set people up for success, really understanding that you're truly ready for this in your wellness recovery journeys. And then, like I said, there's a 40-hour training, which covers a wide range of topics. There's a code of ethics. There's a, supervision requirement. It really is a nice organized profession that inspires people statewide.
Thank you. Thank you so much, Lisa. I am a big supporter of peer support, because the more people you have in your corner, the better your odds are. I want everybody. Like I want to have, like, this is my certified I get to pet cats on Tuesday supporter. Like, the more that you can have, and if you don't like cats, we got dogs, goats, llamas, horses. I mean, we can just open it up to all the animals. Lisa, thank you so much. I know that peer support is new, and it is still one of those things that just has some controversy and some myths, but eventually that will go away, just like everybody else, or everything else. So once again, thank you. All right, Vickie and Jennifer, we're gonna jump back over to you. Let's talk about insurance. What do we need to know when it comes to mental health and insurance in the state of Tennessee?
So for mental health parity, it's primarily the fact that if a company pays for behavioral health, that they have to show parity. It has to be the same as if they're paying for medical procedures. It has to be the same amount of visits, the co-pays, everything has to be the same. That's typically what parity is. So we work to make sure that the companies are being fair and treating the people fairly when it comes to paying for mental health services.
Now,
Exactly.
I'm sorry, Lisa,
Can
please.
I touch on that a little bit?
Yes, please.
Okay. Yeah. So I know that it can be a little confusing, but really it does break down to, if you're paying $30 copay for a physical health care, then you'll pay $30 for mental health care. If you get so many physical therapy visits allowed that will be covered by your insurance company, then you'll get that same amount of mental therapy. And so it really does come down to that. And if your health insurance does cover mental health and substance use, then it has to be the same. And if you do have any issues, that's when you call Vickie and her team.
Wonderful. Now, this question is for both Lisa and Vickie. Is it a requirement for employers to provide mental health care? Can they just stick to the physical and say no therapy, no psychiatry? If you have depression, tough. What are the laws about that? Because we hear a lot of complaints out in the community that people can't see a doctor, they can't see a therapist, or that psychiatric medications aren't covered. Is it a requirement to cover it?
Yeah, well, so yes and no. I know that there are some plans that do not provide coverage for mental health services. I know the limited benefit plans do not. Most of the major medical plans, most of the large employer plans do provide mental health coverages, but the limited benefit and some of those other smaller plans do not. So that's one of the issues that we deal with daily. And also just want to point out that right now, what we're seeing is that a lot of mental health practitioners are no longer accepting insurance. And so that's presenting a whole different line of problems that we're encountering because the patient still needs to have the services done, and they're not denying to see the patient, but the patient is the one that will end up having to file the actual insurance with their insurance carrier. So it puts a little extra burden on the patient that may already, they may already be overburdened needing those mental health services to begin with. So that's been kind of a shift that we've noticed over the last year or so.
Now, if somebody's having an issue with the exact piece that you just said, they have to file their own claim, or their provider switched over to cash only. Is that something that your team can help with? Can they call Vickie?
They can call us and we can walk them through the process, but because it's not really, there's no law that says that an insurance company has, that a provider has to take insurance. So it's not something that we can really like mediate to try to, make things any different, but we can certainly walk them through the process of how to get that claim filed so that they can be reimbursed back for the money that they've had to pay out.
Wonderful. Thank you so much, Vickie. Lisa, anything to add on this topic?
I was just thinking about how complicated and confusing it can be sometimes to understand your own insurance options and navigating that system. So I'm just so thankful that Vickie and Jennifer are there to help folks.
I'm always very fond of saying that it's a cumbersome process when you're like 100%, right? Anybody who's ever had to do any amount of paperwork to buy a house or a car, like these are things you're excited about, right? Like think of how difficult that is. Now do that exact same thing, except you're sick and you're worried and you're scared and you're sick. Did we mention the sick part? And I feel, I get pushback on this sometimes, but I feel that the insurance industry is more complicated than buying a house or a car. And anybody who's ever purchased a house and has, gotten the cramp from signing their name 800 times understands how difficult that could be. Jennifer, before we move on, any final words?
Yeah, yes, insurance can be really complex and a couple of different things. For one, even if you have just a question about how your insurance works, or whether it's health insurance or other lines, but pertaining to this conversation, health insurance, if you're just confused or you have a question about how it might cover a mental health or substance use care or service, then you can always call Vickie's team, Consumer Insurance Services, and I'll give you that phone number as well. We also have a lot of great information on the consumer education page on our website. So if you go to tn.gov/insurance, down kind of at the bottom right, there's a little button you can click called Consumer Education, and we do have a lot of great information about insurance there. And I just wanted to mention one more thing as far as insurance companies that are required to follow parity. Any plan that you get from the Affordable Care Act has to definitely have those mental health parity coverage. So I will, just say that. And yeah, pretty much any large group insurance company is going to have that.
Wonderful. Thank you so much. So did I get the website right? tn.gov/insurance?
Yes.
So everybody can head that way. And then you have alluded to Vickie's team a time or two. How do we contact Vickie's team?
So we can be reached at 615-741-2218. That's a direct line in that comes straight into my staff. It'll get you to, a life and health or property and casualty investigator. 615-741-2218.
Oh, ignore that one. Hang on. Let's start over. Gabe messed it up. All right, hang on. Edit. So it's 615-741-2218. I'm going to write correction. See, I can admit when I'm wrong. I don't care what all my ex-wives say.
That is our contact number. Also want to let you know that Jennifer and I do a lot of outreach all across the state of Tennessee. We are out 2 or 3 times every week, going around speaking to people, making sure that they understand that we're there and what we do. We want to be available for anybody that needs that resource. So that's a big part of our job responsibilities. And if anybody ever needs a speaker or anything like that, they're more than welcome to call us and we will come out. We are all over the state of Tennessee all the time.
That is wonderful. Vickie, thank you so much. I know that insurance is one of those things that can be frustrating, but it is what we have right now. And while it is really easy to just throw up your hands and get frustrated, remember, if we throw up our hands and get frustrated, we don't get the care that we need. Our loved ones don't get the care that we need. So I'm very glad that Vickie's team is available and that all of you are available. But please, this is where advocacy is certainly very, very important, and a little tenacity goes a long way. So sometimes it is unfortunate and we want to vent that we're in the situation that we're in, and that's okay. But after we vent to our friends and get that out of our system, we want to turn that into some positive action, and that action is to keep moving through the process or contact Vickie's team as needed. All right, Lisa, we've got a great question for you. Lisa, talk to us about TDMHSAS and what you are all focusing on during Mental Health Awareness Month.
Absolutely, I'd be happy to. And I mean, really, every month in our department, right, is Mental Health Awareness Month. But I can share with you that we are celebrating the huge new investments that the governor and the legislature put into our FY23 budget starting July 1st. And the increase actually comes to an additional $360 million. We are so excited about that. We're looking at pay raises for a lot of frontline staff. We're looking at more children's programs, all kinds of great things. We're really excited about that increase and so grateful. Our Office of Children, Young Adults, and Families has been doing all kinds of awareness activities and a lot of social media postings. I know they have achieved 35 proclamations throughout the state where mayors are recognizing May as Mental Health Month. And I should also say we're participating in amazing events like NAMI walks. In fact, I walked here in Nashville this past Saturday. Took my family, took my dogs. We had a great time, and it's always so inspiring to see so many people come out to lend their support.
That is awesome. I have to say, I absolutely, I don't know if I got on screen fast enough, but when you said every month is Mental Health Month for us, I like shot out of my seat, and because right, it is for us, right? I'm glad that everybody else can like share in our joy, but it's every day should be Mental Health Month. I wish that we would pay just as much attention to our mental health and serious persistent mental illness in January and June and July as we do in May. But hey, we're 1/12 of the way there, right? We're 1/12 of the way there. So thank you, Lisa. We're going to swing back to Jennifer and Vickie. So obviously a lot of talk about health insurance and if you have it and what does it cover, but what happens if you're uninsured? What about the people who live in Tennessee who currently do not have health insurance? Jennifer and Vickie, what advice or messaging do you have for them?
Not a whole lot.
Well, I will just say, definitely if you are looking to get health insurance, you don't have health insurance through your employer, for example, you can go to healthcare.gov and look for a plan that might be able to suit you. Actually, my brother-in-law lost his job recently. He got a new job. He's good now. But, they had to go look for a health insurance plan. They have a family. They have 2 young children. And I've had to use it myself. And it's great to have that option. You can find a plan that can kind of suit you, even if it is just for the short term. Also, another thing is, of course, Medicare helps seniors. There's TennCare for low-income pregnant women, caregivers, and residents with a disability. And then there's Cover Kids for children in Tennessee as well. And when you are looking to get health insurance, just be careful because there are some organizations that seem very legitimate and seem like it would be a great option for you. But if they don't say they're a health insurance company, then they are not regulated by us, by the Tennessee Department of Commerce and Insurance. And so if there is an issue with that, we really won't be able to do much to help you. So just be careful, make sure that it does say that it is health insurance, a health insurance product, and just do your research. If it sounds too good to be true, it might be that it is.
Yeah. And
And
in a
you
lot
can,
of,
oh, go ahead.
I'm sorry, in a lot of situations, there are certain open enrollment periods for purchasing health insurance. So if you're outside of an open enrollment period, you may not be able to find a policy until that open enrollment period comes around. So that's one of the bigger problems that we have to deal with people that are uninsured.
If somebody is uninsured, is Vickie's team? Can I pop Vickie's team up on the what number? Is there a? Hang on, I'll get it right in my head eventually. Can they call you if they're having if they're uninsured and they're looking to get insurance? Is that another service that your agency provides?
Well, we can point them in the direction of where they may be able to find an insurance policy. Like I said, it's going to depend on their own individual situation, because if it's outside of an open enrollment period and there's not a reason why they don't have insurance, like they just lost a job or had some other type of qualifying life event, they may not be eligible to get a policy at that particular time. But we can certainly talk to them, talk through that issue with them, and see what we can do to try to help.
Wonderful, wonderful. Thank you so much for existing for the people of Tennessee, of course, because it can be overwhelming. I really sincerely, I go back to that, purchasing a house or purchasing a car. I mean, that's like an exciting thing, right? People are excited to get their homes. They're excited to get an apartment, a new car. And even that is a cumbersome process that we hear people complaining about. There's a million jokes about how many times you have to sign your name to buy a house or a car or even lease an apartment. And again, these are exciting things. So I really hope that I can get out in the world that it's not that people are complaining or that they're unwilling to comply, or that it's very difficult to be sick, right? Like that's a hard stop, right? And it's very difficult to do paperwork. Like that's a hard stop. So the convergence of the two can be very difficult. So thank you all. Thank you to your agency for assisting with this, because having an ally can really, really make all the difference. Lisa, I have essentially the same question for you, worded slightly differently. How can you help? How can TDMHSAS help Tennesseans who don't have health insurance?
I'm so happy to tell you that we have an amazing program called the Tennessee Behavioral Health Safety Net, and it offers essential mental health services to uninsured adults who have no other way to pay. It's not really an insurance program per se, but it does ensure that Tennesseans can get this core set of mental health services to keep them moving forward in their wellness and recovery. I think one of the things people often think about, or I do anyway, is the importance of medication these days in treating mental illnesses. I myself take medication as part of my own wellness plan. If people get in a situation where they don't have insurance, they really need to be able to keep those things that those mental health services that keep them stable. And so the Behavioral Health Safety Net can do that for them. In addition, there's a Behavioral Health Safety Net for children, and it covers services for kids who are uninsured, those who have coverage but maybe have used it up, and those whose insurance doesn't cover behavioral health services. Actually, folks can call our department helpline. Let me give you that number, Gabe. It's 800-560-5767. That's our
And that is called the department helpline?
Line, yes. We have peer advocates who answer that line, and they can provide information about the Behavioral Health Safety Net and how to sign up.
That is awesome. Thank you. So before we wrap up, I want to make sure that I have the opportunity to display all the phone numbers and web addresses that we've talked about. So I'm sort of going to go in order, and please, if any of them are incorrect, I know that you will tell me and we will just correct them. But the first one was the crisis line, and I believe that is a 24/7 free crisis line that anybody in Tennessee can call, correct? That's 855-CRISIS-1. Did I get it?
Yes, you got it.
Awesome. Thank you. And then for insurance issues, there's a website, tn.gov/insurance. And I believe, Jennifer, that you said scroll down and it's over there on the right.
So yeah, tn.gov/insurance does have a lot of great information about the insurance division at our department. But you can go down to the bottom right. There's something called consumer education. Click on that. And so if you're just trying to learn more about how insurance works, or even more about health insurance or more about auto insurance, we have lots of great information about that on our consumer education page.
Wonderful. Thank you so much. And then, of course, Vickie's team. That's just what I call it. It's called Vickie's team from here on out. It is 615-741-2218. Vickie, I know it's not actually called Vickie's team. Can you give everybody just sort of a little hint? What is the actual name of Vickie's team?
It's the Consumer Insurance Services Team.
And you can call that number if you're having issues with your insurance, parity,
Yes.
getting claims paid, and Vickie or somebody on Vickie's team will help you out. And then last but certainly not least is the department helpline. That's 800-560-5767. And Lisa, what information can be found there? Who should call that number? How is this number relevant to our conversation?
Sure, absolutely. Our peer advocates answer that line and provide a lot of behavioral health resources. People call in, they're just looking for behavioral health services in their local community. They also provide a listening ear, and they do manage quality of care complaints. All of that they can help with.
Wonderful. Well, thank all three of you for being here. Are there any last words? Like this is like the most open and like whenever you become a host and you go through like video podcasting hosting school, like do not ask open-ended questions. But listen, I'm special. I do everything wrong and yet somehow I'm still here. Are there any other information, tidbits of information about health insurance, peer support, advocacy, self-advocacy? Any last words that the three of you would like to offer to our viewers? And who would like to go first?
I'll go.
Yay, Lisa.
Well, as we were talking, I was just thinking about how I kind of have this theory that as we've come through this whole COVID global pandemic experience, I think one of the things we are already starting to see is reduced stigma about getting help for behavioral health issues. And that's pretty exciting. And so I do think that's going to translate into more and more services. We know our budget's increasing, and ideally more insurance companies that are taking care of parity, that are providing that kind of coverage.
Wonderful. Thank you so much, Lisa. Final thoughts, Jennifer or Vickie?
I have just one thing to add as it pertains to health insurance, and this doesn't really apply to mental health as much, but I just want to get the word out that there was a federal law enacted called the No Surprises Act, which if you know what surprise billing is, it's when you think that your insurance is covering a service or covering care from a certain provider at a hospital, for example, and then you come home and you get this very large bill that basically says that no, your insurance did not cover it. Well, this law basically is to prevent that. So if you do go to a hospital for any reason, and it is in network or you believe it to be in network, any provider at that hospital is going to charge you at the in-network rate. So trying to prevent that surprise billing so that you don't come home and end up with thousands and thousands and thousands of dollars in debt. So and we have more information on that on our website as well.
Awesome. Thank you so much, Jennifer. Vickie, final thoughts.
The only thing that I really want to add is the fact that I know during COVID, there were a lot of people that needed to see a doctor or needed to see a healthcare professional and couldn't because of COVID. And so a lot of things switched to telehealth. And I'm just really pleased to know that a lot of the insurance carriers are still paying for telehealth visits. And I think that that's really great that they're still willing to do that. COVID is still here. I just got over it last week myself. So I think that just, for people to know that that's still an option in case that they are needing some type of, health care or whatever, that they may still be able to get that through telehealth. Just want to put that out there.
Wonderful. Thank you so much. I've said if there is a silver lining to the pandemic, it has been the additional talk of mental health that has been fantastic. I think more people understand than ever before, and also the acceptance of telehealth. You know, the
Mhm.
people in the mental health community have long been pushing for telehealth because it's difficult to get rides. It's difficult to leave your house when you have depression, anxiety, agoraphobia,
Yes.
mental health conditions, and but insurance companies wouldn't cover it, et cetera. So there's been a definite acceptance of telehealth, which has been wonderful, and hopefully that is here to stay. Thank you all so much for being here. I sincerely can't thank all of you enough. I'm going to pop up the department helpline one more time. Anybody can call if they have questions. It sounds like they are a great resource to direct folks. Thank you, Lisa, for giving us that. And of course, anybody in Tennessee in crisis, in addition to the national crisis hotlines, we have 855 Crisis 1 in Tennessee. Please don't hesitate to use that. Thank you, everybody, so much for being here. Of course, we always end by telling you about NAMI Tennessee's email list. You can learn everything that's going on in the state of Tennessee that NAMI Tennessee has their hands in, including legislative advocacy and, of course, events like NAMI at Home Live. It's absolutely free to sign up. All joking aside, no toasters. I get no toasters. Don't worry that I'm going to end up with toasters. It is just very, very beneficial to you. It's very easy to sign up. Go to namitn.org. And of course, the website itself just has tons of information about upcoming programs. Everything that NAMI Tennessee does is absolutely free. So please take full advantage. Thank you, everybody, for being here. And thanks to our wonderful panel. Big round of applause. Yay. Thank you, everybody. And we will see you next time on NAMI Tennessee at Home Live.